Welcome. This is the Learning Lab. My name is Roman Garcia. Today what I'm going to show you is the principles that are the fundamentals of the protocol that we have in order to correct bow-legging or knock-knee. Now, the reason I think that this is important is that anybody that's suffering from these conditions, they need to understand exactly where this deficit exists in the knee. Because unless you really understand what's going on in the knee and you understand the biology and the physiology behind of what causes these conditions, it doesn't matter what you have in your possession. If you don't have a solid understanding or an education, then nothing that you have or nothing that you use is going to be able to help you. Now, what I want to show you is what principles our protocol are based under or are based from. Now, the three principles that underline our program are these. And they're all based on biology and physiology of tissue. Now, the three principles are these. The first principle is pliability. Now, what pliability means is that every tissue, no matter what age the individual has, every tissue has pliability. And what I mean by that is each tissue has a soft consistency. Some tissues, depending on the use that the person has put that joint through or a genetic predisposition, some tissues are drier than others. But all tissues have an pliability that can be unlocked under the right environment. And now, the second principle is manipulation of stress. One of those stresses that need to be manipulated is weight. Now, unless you're able to manipulate the weight, the stress, you're not going to be able to create any tissue changes, no matter whether it be in the knee or any other joint in the human body. You need to change the weight if the weight is of a high level. And that's the idea of the unloader reaction brace that we promote in these videos. Because the unloader brace is one mechanism to alter the weight-bearing load. So unless you're able to manipulate the weight-bearing load, you're not going to be able to correct any type of bowing or knock-knee. Now, the third principle that underlines our protocol is adaptability. Now, what this means is that the human body adapts to its environment. If a tissue is exposed to no loads, it atrophies. If a tissue is exposed to too much load, it degenerates on you. You gotta find the proper medium. And that's what I mean about adaptability. The human body, especially the joints, are designed to adapt to its environment. So if you change the environment, you change the structure, the form of the joint. Now, I want to show you this picture because this picture is very important. This is what I'm going to show you is the inner structure of a knee joint. Imagine this is a human knee joint that has been cut in half. So you're basically seeing the middle aspect of the knee joint itself. Now, if you get a human knee, or for that matter, any kind of long bone in any animal species, and you cut it in half, you're going to see a grid-like framework. That grid-like framework is what is denoted by these lines right here. Now, each bone has this grid-like structure to it. This grid-like structure to it takes the form of the stresses that that bone has been exposed to. Now, our protocol is designed to slowly, over time, to change that grid-like structure that's inside the bone. In a little while, I'm going to show you how important what I'm saying right now is. Now, what we want to do, what this protocol does is it changes that grid-like structure from a bowing structure or a knock-knee structure, which may be formed in this type of grid-like pattern, to something like this. As the bone changes, that inner substance of the bone will also change, and that is the fundamental change that occurs whenever you start seeing the correction. The inner matrix of the bone itself starts to change. Now, I'm going to show you, you can come to me now. I'm going to show you an example of that inner structure on how something that you would assume to have been corrective It's not, because of the fact that the inner structure did not change. And let me show you so you can better grasp what I'm saying. Now, this is a patient that we saw not too long ago. This x-ray was done in March. This x-ray was done in May. About a 2-3 month difference. We put an unloader brace on this case. This patient was a very old patient. So not enough time has passed in order for this person to experience any structural change. But the reason I'm showing you this is not because of that, but because of what they did to the right knee. Now look at this, how interesting. They did a joint replacement on the right knee. We treated the left knee. Again, this is March, this is May. Now, you would think that when they did the replacement on this individual, by the way, this individual is in a knock-knee pattern. She was very knock-knee, so I assume that when they replaced this right knee, it was also in a severely knock-knee pattern. Now, the interesting thing is this. When they did the joint replacement, you would assume, since they cut a piece of the bone off, that when they put the prosthesis in, they would have corrected the knock knee. They eliminate maybe about a 1/4 of an inch of bone, maybe a little bit more depending on the size of the prosthesis. But look at how interesting. Even though they replaced the knee and they put a prosthesis in, this individual is still knocking. There's still a knock-knee structure to the knee. Now, the question is, why would there still be a knocking of the knee if when they put the replacement is put in a very straight pattern, just like this, parallel to the floor. It's completely horizontal. Now, why would this individual still be knock-knee? And the answer is because knock-knee occurs not at the surface, but at just below the surface. Actually, on the upper part of the tibia itself. Knock-knee occurs right here. This is what needs to be shaped. This is what needs the matrix, that inner structure. That's what changes with our protocol. It's not at the surface. It's at the just underneath the surface itself. That's the only reason you can explain why this individual, when they did the replacement, didn't correct the knock-knee, because the replacement only changed the orientation of the surface itself. It didn't do anything to the underlying bone, where the grid is structured in a knock-knee pattern. So our protocol is designed to change that grid-like structure, but it occurs over a period of time. Now, what I want to show you now is an example of adaptability of a bone to a knock-knee pattern. And Carlos, we can go over here. We'll turn the light off so you can get a better look. Now, this is a relatively young patient. This person is in a knock-knee pattern. You see the line right out here, and it's crossing over the inner half of the knee. Now, I circled where the bone is adapting. Obviously, since this person is in a knock-knee pattern, there's stress converging to high levels, very high levels, on the outside part of the knee. You can see this is the fibula right here. This is the outside part of the knee. This is the outside, this is the inside. This is the right knee right here. Now, I circle where that adaptability is occurring, right here. You see like a white spot. That white spot is adaptability. It's the bone adapting to that increased load. It's getting dry, and it's getting dry where you would expect it, on the outside part of the knee. And it's just starting. This person does not have any pain in the knee. You can see how much cartilage this individual has. He has quite a bit of healthy cartilage inside the knee. He's just concerned because when he looks himself in the mirror, he can see that his knee is knocking. So he knows that there's something not normal. So this individual, we're going to be placing an unloader system, not because his knee is in pain, but to prevent future degenerative changing from occurring, which will occur on the outside part of the knee, and you can already start seeing the tissues adapting to that increased load. You can see it right here. It's very sclerotic, very dense, very dry. Eventually, this adaptation, it will creep itself onto the surface. It will start to affect this in the outer half of the knee. The cartilage will start to degenerate eventually. So that's the purpose of the unloader brace for this patient, as a prophylactic, as a preventive measure, which he's going to use based on our recommendations. This patient, we're just starting to work with him. Now, what I'm going to show you now with my live assistants here, Ana, is I'm going to show you. I'm going to do this. Acuéstate. We know that Ana is in a knock-knee pattern. We know that she's in a knock-knee pattern. Her knees do not hurt. But most knock-knee patterns, most people will have this hyperextension if they're knock-kneeing. Most folks who have knock-knee, and Anna's she's knock-knee, will have this hyperextension. This is a classic sign of an individual who's in a knock-knee pattern, hyperextension. So if you see this video and you want to see if you're knock-knee or not, this is a test that's very sensitive to individuals who are knock-knee. They tend to hyperextend. Now, Anna, I'm going to show you where the knock-kneeing occurs in people. This is where our protocol, the changes occur. It's not at the joint surface. It's not here. This is the joint surface right here. That's why that prosthesis didn't correct that patient's knock-kneeing, because the prosthesis only worked at the surface, at the joint surface. Knock-kneeing or bow-legged occurs down here. Right down here. This is referred to as the epiphysis. At the epiphysis of the bone. It's the upper end of the bone right before it gets to the joint. This is where the bone is in a shape that causes knock-kneeing or bow-legged. It's underneath the joint itself. This is the area that needs to be structured, molded, formed away from knock-kneeing or bow-legging. This is the matrix. This is the matrix that needs to be changed, and that's where our protocol corrects. It's at the matrix underneath the joint surface. Now, again, like I said, Carlos, you can come to me now. Like I said, in order to deal with these knock-kneeing or bow-legged conditions, the most important thing is information, is data. Because education, understanding of what's going on is the remedy in order to correct these conditions. If you get any kind of product without understanding the biology, the physiology, the mechanism, the biomechanics behind what's happening, you're not going to be able to use the equipment correctly with the proper understanding. So that's why we always encourage information, but it's a lot of information, so we give it a little bit at a time. Again, anybody who watches this video, if you have any questions whatsoever on any conditions that you may have, if you have bow-legging, if you have knock-knee, if you want any of the products that we have, we not only sell you the product, we educate you, which is the key. I always emphasize education, understanding the biology and the physiology. If it's explained to you in a precise manner, everybody can understand and everybody can introduce an environment to create these changes. Because the last thing you want to do is start reaching your later years in life and not be able to ambulate, to function. These are the best times in your lives where you have the most wisdom, the most experience, and it's time, and it's a moment that you really need both knees, both legs working properly. But again, anybody who watches this video, if you have any questions whatsoever, we always put down a phone number. If you have any interest in understanding biologics, which is the newest regenerative methods that are being used now in orthopedics, just give me a call, email me. I'm always at your disposal. Anybody who watches this video, thank you very much. Until next time.